And you ready for another couple of questions? So, your time starts now. Sandra is a 35-year-old female, presents to your clinic with a 1-week history of an intensely itchy rash. Her examination is normal apart from an itchy rash involving her trunk, limbs, fingers, palms of her hands, toes and soles of her feet. The rash does not affect her scalp or face. She suffers from epilepsy for which she's on sodium valproate. The picture of the rash is given below. What is the most likely diagnosis? Please write one specific diagnosis. A little late on the clock, sorry. We'll take about 30 seconds after that. Alright, we'll probably wrap up the time here. Moving on then, what would be the appropriate management of Sandra's condition? Please write 4 specific management steps. All right. So, some awesome responses there. Good job, guys. And this one is scabies. So, good job to Demir. 100% correct there. And Dinesh, this is probably the thing they're trying to trick you with here. And certainly the sodium valproate's the thing that I'm sure you saw and thought, oh, this could be a drug eruption. And yes, we know anti-epileptic medications can be associated with drug eruptions as well that can give you these kind of widespread itchy rashes as well. I think the thing that helps differentiate it here, and this is where again you have to be very, very particular with teasing out the right information from the stem of it, is that it does not affect her face or scalp, which would be spots that I would expect you would still be able to see those drug eruptions, which tend to be more confluent in nature, which, as you've kind of said into there. As for then what we would do to treat it, so definitely calamine lotion for itching. I don't think that oral antihistamines make a massive difference for scabies, but certainly if you are going down that drug eruption pathway, as you have done, certainly oral antihistamines can help with, of course, as you've got there, stop the offending drug. And certainly if you do stop the offending drug, particularly with the anti-epileptic medications, the rash does resolve quite quickly. And don't worry, Dinesh, this is why we practice, so that we can improve and get these things. And don't forget as well, in the actual exam, you normally get relatively crappy pictures. Certainly if you've sat any of them before, when you get the printed exam, if they do stick to a paper-based format, just interpreting the picture in the first place can be difficult. And try to think back that they're not trying to trick you with anything, not trying to be too nasty with it. Again, there's 26 cases per exam, so you can completely train wreck, a couple of cases and still do absolutely fine. And this is why we practice. Demir, well done. So cover the whole body with permethrin cream. Don't get caught up on the spelling at all. That's something that they're very clear. They don't care if you don't spell it properly, provided that it's clear what you're intending to actually prescribe. And yes, perfect. Treat all household members. Wash the bed sheets. Again, oral antihistamines don't tend to be overly effective for scabies, but certainly isn't going to cause any harm. Calamine lotion is the thing that RACGP and handy guidelines really try and push for treatment for this. Now, also, things like this to advise would be advised to stay home until the rash settles, given it is going to be a contagious thing.